Hello, I am Dr. Adriana Potter. I am being a physical therapist for 15 years. I'm a graduate from Northwestern University, and one of my specialty is pelvic floor physical rehab. The pelvic floor is pretty much the muscles on the bottom of your pelvis, and if you look from the bottom, they form the genitals, and you can see the opening for the rectal area, for the vagina, and the urethra. Okay, from the inside we have all the organs and the uterus, and the bladder sits right in the front of the pubic, right in here. This is kind of a little bit out of place, and the uterus sits right in the back. And when you look all the way in the back, you can see that it is the rectum. Okay, I'm going to take it out, and this is the rectum. So this angle in here is very important to know because the pelvic floor kind of becomes a slings underneath of it, and it looks like a bowl when you look from the inside. Okay, so this muscle is just like a muscle anywhere on the body. It contracts and relaxes, and the main job it is to control bowel, bladder, and sexual function and organ support. And when you're having a dysfunction in the area, it will affect all those systems. When it comes to the bladder situation, there is a opposite behavior happening between your bladder and your pelvic floor, right? The bladder is always relaxed, and it's like a balloon. It keeps expanding, accommodating for the fluid inside and getting bigger. And the pelvic floor is always working. And I describe that as a resting tone. It's like an underneath activity that is supporting your organs all the time, right? So when the bladder gets full, you feel the need to go to the bathroom. In a normal situation, people walk to the bathroom, sit down on the toilet, relax your pelvic floor, and then the bladder will start squeezing on you and the pee will come out. Okay, so nice, good gush come out, and you should feel that bladder emptying all the way. Okay, for the bowel is similar situation. So the bowel is processing throughout your GI system. The rectum gets full. When it gets that fullness feeling, you feel the urge to go defecate. And when is a good time, you attend to the urge, you sit down on the toilet, relax your pelvic floor, and when you relax the pelvic floor, this angle here becomes a little bit straighter. So I call this the kink, okay? And different therapists probably will describe this in different ways, but this is how I describe it, okay? So that kink gets a little bit straight, and it makes it easy for the poop to pass. And then you gently bear down by using abdominal muscles, and the bearing down should be gentle. It shouldn't feel like you are passing a baby or anything like that and it's turning red. You should feel like that, no more than that. And if you're pushing more than that, if you're bearing down more than that, you are bearing down too hard. And the biggest issue with that is that you might be pushing the organs out into the vaginal canal. So here is the vaginal canal. It's like, the cervix is inside, right? And I usually tell like the cervix like a cone. And here's going to be a uterus, and your pelvic floor is just kind of supporting there and becoming the vaginal vault. So when you bear down too hard because you're pooping and pushing too hard, or you're holding your breath, or you're lifting something too heavy and holding your breath, those are some of the main causes of what we call prolapse, which means into the vaginal canal. Either your bladder, that it is in the front, will go pushing to that anterior wall, which is anterior, means to the front of the pubis, or your rectum will come towards the back into the posterior wall, which is towards your tailbone, or your cervix, the uterus, will fall downward. Each one of them has specific names. So we have a cystocele, uterocele, and then a rectocele. That's when your organs are falling into the vaginal canal and bulging that vaginal vault. And once it's bulged, one is prolapsed, that's it. There's nothing you can do about it. And you can decrease the effects of prolapse by doing pelvic rehab. But it's important also to change the behaviors that brought you to have that issue. Stress incontinence usually happens when your continence needs a laugh, that your muscles are not having a good coordination and contracting it quickly enough to keep the urethra closed. And it could be because abdominal muscles are not strong enough and you're not controlling the pressure on the abdominal cavity. So you are bulging on your abs when your continence needs a laugh. So if you bulge in your abs, you bulge downward as well, and it pushes the bladder down and the pee comes out. And also for fecal incontinence. The majority of the time when it comes to fecal incontinence, it has to do with a consistency of the stool. The majority of the time, like I said, usually people that have fecal incontinence, the stools are usually more in the liquid area. And then I will have a lot better conversation about the fecal parts of it, and how to control the constipation, diarrhea, and all the issues under the video for the bowel control. But that's pretty much the pelvic floor. Another important thing to understand about the pelvic floor, in addition to the support of your organs in assisting bowel, bladder control, and sexual function organ support, it is of the stabilization that happens to the sacroiliac area. Okay, so when the muscles contract, you should feel the tailbone, it kind of curling under you. Okay, and the openings is kind of coming, lifting up and in. So there is a squeeze effect and a lift effect on the muscles. And that's how pelvic floor physical therapists will assess it. And that's why it's important to have a pelvic floor rehab assessing you for the function of the muscles. And the assessment is vaginally, similar to what a gynecologist does. With a digital examination, we assess that function of the muscle with the purpose to check for muscle contraction, muscle relaxation, and there's any pain in the area, because you can have pain with intercourse, which is not normal. And we can kind of give you options about how to treat and how it can be done in the clinic, on your own, or with the assistance of the partner. But the force closure that I was just talking about a while ago, it is the SI stabilization. So when you're pregnant or when you have a lot of hypermobility issue, these joints shift too much. And the pelvic floor will kind of hold them all together, like a hugging effect. That's what I call a force closure, hugging effect into this area. It kind of squeezes everything in. So doing pelvic floor rehabilitation and incorporating the ability to engage these muscles with different activity is the most important thing. Doing a Kegel is important. It helps you to restore the strength of the muscle, but it's not enough. And let's be honest, Kegels are boring. Nobody wants to be just squeeze, somebody go and doing that. And so doing functional exercises with your Kegels, and by the way, Kegel is the name of the doctor who found out those muscles contract, so the exercise being named after him. So you're going to be seeing me talking about Kegels, pelvic contractions, squeezing your muscles, pull it in the Kegels, pull it in. So different words to describe the same thing, which is the contraction of the pelvic floor. That is important to create stability to your pelvis. And it can really help to decrease that excessive movement that happens in the joint. And it should be incorporated in the functional activity with abdominal exercise, with lumbar sacral stabilization, with standing exercise, with arm exercise. But that is it. In a nutshell, that's how I usually describe to my patients what the pelvic floor is and the function. And then usually I go in with the details with each person to find out their issues with the pelvic floor. So find a pelvic floor that can help you to identify what are your issues and how that you can best address them. So for today is all. Thank you. Bye.